Good morning. Good morning, everyone, and welcome. I'm Cliff McKinney, Vice President of Sales at The Hill. Thank you to everyone joining us online and in the room for our event, Health Safety Net Programs Will Older Adults Fall Through? I'd like to thank our sponsor, Alliance for Aging Research, for their support of this very important discussion. Federal health policy has seen major shifts recently. Most notably, millions of people could lose health coverage if the current reconciliation bill's Medicaid cuts become law. In addition, the House of Representatives recently passed a new budget resolution that calls for cutting trillions of dollars from Medicaid, SNAP, and other essential programs that older adults rely on to meet their daily needs. Workforce cuts across the FDA, NIH, CDC, and the Administration for Community Living Health are hitting the country's medical research infrastructure, food safety, and infection surveillance, and support for critical local programs such as Meals on Wheels. At the same time, there are opportunities for positive change. Congress is considering the Ensuring Pathways to Innovative Cures, or EPIC Act, bipartisan legislation that fixes the IRA's pill penalty by leveling the playing field for all types of medicines and ensuring adequate incentives for new drug development. There are also increasing calls for accountability of PBM middlemen and Medicare Part D plans to rein in excessive profiteering and utilization management. What do older Americans need to know about these changes? What are the greatest risks and consequences of these new policies? And what can be done to ensure patients don't lose out on the care that they need? Today we'll hear from legislators, policy experts, patient advocates, and healthcare leaders to examine how older Americans are impacted by this time of rapid change. Before we get underway, a few housekeeping notes, please. If you're with us here in the room, please keep your phones on silent for the duration of the program, but please join the conversation on social media. You can follow us on Facebook, X, and Instagram at The Hill Events using the hashtag #TheHillHealth. And with that, I'm happy to introduce our moderator today, Julia Manchester, national correspondent at The Hill. She's joined by Democratic Congresswoman Judy Chu of California.
Good morning, everyone, and good morning, Congresswoman. Thank you so much for joining us during a very busy time in Washington. I guess not much is going on. I've been up on the Hill this week following House Republicans in particular as they seek to rally around President Trump's legislative agenda. And even though House Republicans, at least for the past few days, have been the main story as they push forward through that, we know that this proposal could very well affect Medicaid, SNAP, and other community programs. SNAP is obviously a food assistance program. Congresswoman Chu, I wanted to get your sense of what's at stake for older adults in particular, and what is the Democrat strategy to push back in the minority?
Well, the proposal by the Republicans for this reconciliation bill, the big, beautiful bill, but really is the big, ugly bill, is the most devastating cut to services for seniors in our lifetime, or the nation's history, I would say, because it is proposing $880 billion worth of cuts to Medicaid and over $300 billion worth of cuts to SNAP. Now, Medicaid is, of course, the lifeline for so many seniors. It is a major funder for nursing care, long-term care for seniors. And of course, we know that there is such a close relationship between Medicare and Medicaid. When Medicare does not cover something, it is Medicaid that steps in. So long-term care, home care, those are things that Medicaid can pay for, but without Medicaid, Medicare will really not cover the whole thing. And in fact, hospitalization by Medicare will cover about 28 days, but after that, Medicaid takes over. So this will be really tough for seniors if these cuts go through. And as far as SNAP benefits, we know that they increased the amount of cuts to SNAP in this last budget markup. And the 98% of those that use SNAP benefits are children, elderly, and the disabled.
Right, right. And, looking back, over the past few months, we know that there's been a number of town halls Democratic lawmakers have had, also some Republican lawmakers, but we've seen a number of very impassioned town halls, including about some of these potential cuts. What are you hearing from your constituents in Southern California?
They are incredibly fearful, anxious, and they feel devastated about the potential cuts that could happen to them and to their fellow neighbors. I have never seen such passion in my life. They have turned out in record numbers at the town halls. They pack each one of them, and it's usually standing room only. They have gone to so many rallies and protests, and they have been in places that were not known for protests. I know that on the hands-off day, the hands-off rallies,
right.
I went to 4 protests, 2 in Pasadena, 1 in Rancho Cucamonga, 1 in Claremont. And Rancho Cucamonga is very unusual because that's a rather conservative area,
right.
But they came out in record numbers, and they packed the sidewalks and brought their homemade signs, but they were very impassioned, and you couldn't even walk along the sidewalks. There were so many people. So I've never seen anything like that. It was a very organic, but it's very clear that Americans all across the country are feeling these devastating cuts very personally.
So we're seeing these protests, we're seeing this large attendance at town halls, but what does the response look like from Democrats going forward? How can they organize, and what is the strategy when you're in the minority, which is a tough spot to be in?
Well, we need to do everything. And what I always say to my audiences is that we need to legislate, litigate, and activate. So on legislation, we are introducing so many bills and so many letters that are protesting each one of these cuts, and scores of legislation, as a matter of fact, to preserve the system as we know it. Because I must tell you, every single one of these cuts is illegal. These are cuts that were appropriated by Congress, and they cannot just do away with these cuts as they please. That is not legal. So that brings us to the next one: litigate. We have more coordination than ever from the legal community. It is coordinated by Democracy Forward, which has been able to mobilize the legal advocacy groups, and as well as the state's attorney generals, who have been all coordinating to meet the moment each time one of these actions takes place. And in fact, they've anticipated these cuts and have put the litigation through right away. And they have been successful in stopping nearly all of these actions. Thank goodness we still have the 3 branches of government. So the judges are in fact stopping these actions and stopping the dismantling of the programs that were approved by Congress. Mm-hmm. And the third part of this is activate. And that is making sure that we do our town halls in greater numbers, that we reach out on social media. We've encouraged all our constituents to tell their stories about how these cuts are affecting them. And I have gotten hundreds and hundreds of stories from people in my district. And of course, we're telling them to go to the rallies and to participate. I encourage them, no matter where they are, to be able to have a town hall, to protest, to have a meeting, because we need to grow these numbers. People need to see that the American people are upset, and that we need to ensure that these numbers grow, because what I always tell them, they say to me, well, I'm just one person, what does that matter? And I always say to them, look, 1 turns into 10, turns into 1,000, turns into 1 million, and we need millions of people to be protesting all of this.
We know that senior citizens are one of the most reliable voting blocs across the country, and another form of pushing back or resistance, you could say, is voting. And we know that Democrats have really sought to make this a major campaign, a political issue, obviously campaign issue, over a year out from the midterms. What can we expect in terms of, I don't want to say targeting seniors, but galvanizing seniors ahead of the midterms? I imagine this is an issue that, understandably, I don't want to say excites, but mobilizes.
So one glimmer of hope are the midterms. So November 2026 is when we can at least take back the House and stop the worst of these actions. So that is one thing that seniors can really put their energy in. Now, we, the Democratic caucus, have targeted 35 seats where there is some change that is possible. And we just need 3 seats. The margin is so slim right now that Republicans are running around trying to get their different factions to buy into this so-called big, beautiful bill. And make sure that they get all votes, and that these votes don't stop this bill. But it's pretty tough when basically you could just have 4 Republicans join together and they could stop this entire thing. So that's how slim the margin is now, and that's to our advantage for the midterms. Now, in the midterms, typically the president's party loses seats. So that's just typical. But what we have now is the lowest approval rating for Trump ever. So we have that on our side. We have masses of Americans that can see democracy is in danger, that the rule of law is in danger, but most importantly, that the basic programs that we've come to rely on, Medicaid and SNAP, are in danger. And actually, with regard to the elderly, Social Security is in danger as well, because there have been thousands of cuts in the Social Security offices around the nation. In fact, Trump is threatening to close down at least 47 Social Security offices. He's cut thousands of these workers and has done such things as threatened to cut off the phone line. Actually, for a while, he did cut the phone line at the Social Security offices, but there were so many protests that they had to reinstate it. And so I think Social Security is in danger as well, and that is what alarms so many of the elderly. So what we are saying to the elderly is we have a big chance here to change things, and your participation in these elections is so important. The seniors in our nation can help with such things as postcard writing. This is something that I noticed they really love to do. Postcard writing to those targeted seats, and making sure that people know what is at stake, that personal message that they can tell the folks. The phone calling is something that they can safely do while in the comfort of their own home or in an office that is nearby them. They can have a huge impact on the outcome of this election.
Right. A lot of conservatives in the House seem to be very concerned about the prospect of this bill going to the Senate, because we know that, just obviously senators have a very, different, broader constituency. I thought it was notable that last week Missouri Senator Josh Hawley was, railing against Medicaid cuts, saying his constituents in his state would be impacted. Is there any hope, I guess, from your perspective, of maybe some Republicans pushing back? I mean, you mentioned that in some conservative parts of Southern California, there has been concern about this. Have you heard that concern from some of your Republican colleagues?
Well, there were 12 Republicans that wrote a letter saying that the Medicaid cuts should not be so deep. And they have a reason to be worried. David Valadao, for instance, in Central California, has a population of Medicaid recipients that is huge. It's 67%. And so if they lose Medicaid, you have a great number of people in his district that will vote against him. In fact, he's lost previous elections. The one he lost was when he voted against the ACA, the Affordable Care Act. So he knows that there will be an immediate reaction if he votes against these Medicaid cuts. So yeah, these Republicans in the House have expressed their concerns, but I think that in the end, Trump will twist their arms so strongly and do a combination of methods, whether it's bribing or threatening, and that they will cave. I think the ones in the House will cave. I think that this bill will ultimately go to the Senate, and what is more interesting is what will happen in the Senate.
Yeah, yeah.
Because you're right, we have Josh Hawley, who is against these Medicaid cuts. We have Rand Paul, who is against the bill for various reasons. But then there is Susan Collins and Lisa Murkowski on the Republican side as well. And for these reasons, I think that the Republicans in the Senate will be more inclined to rewrite the whole bill.
Interesting. We'll be watching for that. And I know we have a few minutes left, but I wanted to touch on Medicare. I know you've been advocating for expanded coverage, with acupuncture and nutrition. Wanted to you to tell us about that legislation.
So there are eating disorders amongst older adults, but the coverage for that is very meager in Medicare. So there is not the recognition that there should be about these eating disorders. And you can only get treatment for it if you have a particular, like diabetes and some other condition. But in reality, we need to have coverage in Medicare for eating disorders. So that's what my bill does. And I do have bipartisan co-sponsorship. So that makes me feel that this could be on its way to success. Acupuncture is another treatment that could be very beneficial to the seniors in our nation. First of all, for such conditions like pain, but other conditions, acupuncture could be so beneficial. But with regard to pain, many seniors don't want to have opioids. They don't want to get addicted. And acupuncture is the perfect solution for them. And yet, acupuncture is not fully embraced by Medicare. Now, we did make a breakthrough just a few years ago when acupuncture was approved by CMS as a method to deal with pain. So that was a good first step, but the problem is that it didn't say that acupuncture could be administered by acupuncturists. So they are the ones who should be administering it. So that's what my bill does. It says that acupuncture should be administered by acupuncturists, and then we would have a full ability for seniors to be able to access this treatment.
Very good to know. Congresswoman Judy Chu, thank you so much for joining us today.
Thank you.
Next up is our sponsor segment from Alliance for Aging Research. Please welcome to the stage Adina Lasser, Director of Public Policy, and Scott Fry, SVP of Public Policy at the Alliance for Aging Research.
Good morning, and thank you all so much for joining us. For nearly 4 decades, the Alliance for Aging Research has dedicated our work to changing the narrative to achieve healthy aging and equitable access to care. Our goal is to advocate for a culture that values healthy aging and embraces science and policies that promote dignity, independence, and equity. Today, our nation's commitment to these goals is more critical than ever. In 2022, more than 57 million Americans were age 65 or older. This number will rise to an estimated 85.7 million by 2050, representing a demographic shift that will have profound social, economic, and health impacts on our nation for many decades to come. We are nearly 5 months into the new administration and Congress, and today's program will feature experts who will discuss recent challenges that threaten our nation's historic bipartisan commitment to those same goals, as well as potential opportunities and the path forward. First, the challenges. We're currently facing the dismissal of thousands of experienced public servants across the government, including leading researchers and public health experts. There's a proposal for the complete reorganization of the Department of Health and Human Services that does not allow for public input. These actions raise questions that we can't answer here today, but our mission and the public interest compel us to seek those answers and work with the administration to ensure that critical functions at the FDA, NIH, CDC, ACL, and other federal agencies can carry forward. There is so much at stake: U.S. global leadership in biomedical research, the safety of our food, pandemic preparedness, and support for critical local programs like Meals on Wheels, just to name a few. We also want to discuss today the exciting opportunities that we're seeing to come together and make meaningful changes for public health and access to care. There is rising interest in Congress to advance policies that protect older adults, such as holding PBM middlemen accountable and holding Medicare Part D plans accountable for excessive profiteering and restrictive utilization management practices. Another incredibly promising development is the bipartisan EPIC Act, which addresses the IRA's pill penalty. We'll hear more about that legislation and all of these important topics throughout today's program. Now, I want to turn to the Alliance's Senior Vice President of Public Policy and Government Relations, Scott Fry, to talk to us a bit about the current state of play on the Hill and throughout the federal government. Scott, fill us in. What's the latest?
Thank you, Adina. And I think pretty much we heard the latest just now from Congresswoman Chu on the reconciliation bill that's pending in the House. We have no idea what the outcome is going to be. As she said, the margins are tight. But we do share her strong concerns. We appreciate the Congresswoman being with us today. Appreciate her leadership on Medicaid and SNAP. We do share her concerns on Medicaid and SNAP. The legislation that's pending, earlier this year, we organized a sign-on letter, 150 organizations. We decided, since there were a lot of organizations expressing concerns about the potential impact of these Medicaid cuts, we decided to focus on the 7 million Americans who are struggling with Alzheimer's and related neurological disorders. We organized a sign-on letter with 150 allies, patient advocates, research folks, friends from the research community, to express a multitude of issues that arise when older Americans need access to long-term care supports and services. I want to highlight one in particular. It should be understood that folks who struggle with Alzheimer's don't necessarily need nursing home care. For the most part, most of them need supports and services for their activities of daily living through home and community-based care. As many of you know, Medicaid requires states to cover long-term care, but states overwhelmingly invariably provide home and community-based care as an optional benefit, which is great. And it has been a godsend for families with loved ones struggling with these illnesses and other chronic diseases as well. One of our concerns about this legislation, as we saw in 2011, after the Great Recession, when emergency increases in FMAP expired, one of the first things that states across the country did was pull back on their commitment to home and community-based care. The legislation pending places incredible new burdens on states, administrative costs, new work requirements, new redeterminations of benefit eligibility at a much quicker cadence than in the past, increasing work requirements up to age 65, limiting the state's ability to raise additional revenues from provider taxes in the future, and also because of the SNAP provisions that add new cost-sharing requirements on the states, it's going to really hamstring state budgets. And so one of our concerns is that we're going to see a repeat of what happened in 2011 times 10. States are going to have to pull away from optional coverage that is not required under the law, and it's going to leave patients and their families struggling for scarce alternatives. As hospitals are squeezed, as nursing homes are squeezed, already struggling with staffing issues. And so this is just one of many concerns we have about the pending legislation. As the Congresswoman mentioned, it's going to move to the Senate likely, and we'll see what happens there. But I want to just note, too, that we really do appreciate the strong bipartisan concern on both sides of the Hill that have been expressed about these changes. And we do certainly hope those members continue to consider that as they vote on this legislation. Moving forward, on another issue that Adina mentioned, the impact of the staffing cuts across the government is very concerning to us. We want to make sure that we do not lose the best and brightest minds that aspire to public service as a career choice. As I have served 9 years in the leadership of a large federal agency, I can imagine what the new incoming leadership of agencies across the government, particularly those at HHS, are feeling as years of technical expertise and institutional knowledge have just walked out the door. They have a statutory obligation to carry out the mission of their program, and they've lost some of the biggest supports that they can have to achieve that goal. So we look forward to working with them. When these rifts were occurring, the Alliance organized a sign-on letter with 50 organizations expressing our concerns about the 17% reduction in staffing at the National Institute on Aging, including a 10% reduction in staff at the Center for Alzheimer's and Related Dementias project, which is a collaboration between NIA and NINDS. We're deeply concerned about the progress of Alzheimer's research. We're on the cusp of a great new frontier in Alzheimer's disease treatment with the production and approval of a new diagnostic test and medicine that can help us target people who could benefit from medicines that can slow the progress of this terrible disease. So turning back the clock on Alzheimer's research at this time would be devastating. We are pleased that Dr. Bhattacharya has come in recently and has begun to hire back some of these people. We would hope that we see this trend repeated across the agency as folks figure out how are they going to run the agency with the loss of this institutional knowledge. Finally, as Adina mentioned, there's not much we can say about the consolidations. We'll wait to see the president's formal budget comes out. If there's any more enlightenment, we have more questions than answers. I think to some extent our panel is going to drill down on that as well. But our fundamental questions to the new administration is, are we going to maintain our leadership in biomedical research as a global leader and all of the economic and healthcare benefits that come to the American people for that? Is our decisions at FDA about the safety of our food and our medicines going to be driven by the best science? And what is the future of the Administration for Community Living that carries out provisions of the Older Americans Act, and what is going to happen with grants to states and local agencies that carry out the mission of the ACL? So we're going to hear more about that later today, but we are excited to collaborate with some of the new appointees in the administration. We look forward to meeting with the leadership of CMS and NIH, and because we think there are great opportunities we can explore together to get make sure that our nation stays on track, as I've discussed. So, Adina, speaking of opportunities,
Yes.
can you explain to me, the president has just endorsed the EPIC Act, and we were very pleased to see that development out of the administration. You discuss what that means for patients' access.
Yes, absolutely. The EPIC Act, or the Ensuring Pathways to Innovative Cures Act, the reason that we're excited that the president has endorsed it is that it undoes a slightly problematic part of the IRA, which allowed for an exemption of large molecule drugs from the Medicare direct negotiation program for 13 years, and small molecule drugs only 9 years. What we're already seeing as a result of that is research and investment moving away from those small molecule drugs. And when we think small molecule, we're thinking things like pills versus large molecule, often they're injectables. There's a lot of concerns about that. A major one being that small molecule drugs are often easier and less expensive, and especially for older adults, it's much easier if you can just take a sip from a glass of water and take your pill versus having to set up an appointment, go get an injection, go get an infusion with your provider. And that, it's not just the cost of the medication itself, it's also the cost of the appointment, the cost of getting to the appointment, having your caregiver take time off work so that they are able to take you. So there's all of these knock-on effects that we're very concerned, and we need to make sure that this is fixed, and that's what the EPIC Act does. It just provides equal exemption for large and small molecule drugs. And so that way we're following the science and not these sort of incentives that came out of, very little.
It's very exciting, thank you. And what other developments are we seeing that bode well for patient access to care?
Yeah, we were excited to see a recent executive order from the president on drug pricing initiatives. It highlighted a number of our priorities and a number of things that will really actively protect older adults from seeing the incredibly high prices that we've seen. And so some of these things are provisions surrounding pharmacy benefit managers and making sure that they're more transparent in their pricing, they're passing through their savings or the rebates that they're getting from drug manufacturers, and that there are guardrails surrounding what's appropriate and what's not. Another is utilization management. We've already started to see, as a result of the IRA, an increase of the use of coinsurance over copayments at the pharmacy counter. And this is because of provisions that started in 2025. So this is something where the avalanche is just going to continue to go down the hill. To offset those costs that the IRA put onto the insurance plans, they're using utilization management. And when isn't driven by clinical guidance, but rather by financial justification, that's where we're very concerned that people will progress unnecessarily in their disease state. We were excited to see in his confirmation hearing that Dr. Oz actually touched on this issue. He talked a lot about how doesn't only make for burden for patients and increase costs for patients, it also directly impacts providers. I actually have a brother-in-law who he's a physician, and he told me that he spends 8 hours a day doing peer-to-peer with insurance companies. So it's things like that that we want to work with the administration to mitigate and to fix.
Great.
Scott, I just have one last question for you. You and our president and CEO, Sue Peshin, attended a number of the IRA stakeholder roundtable meetings for the 15 selected drugs that happened very recently. I know you both said that there was a big improvement from last year, and I was wondering if you could talk a little bit about that.
Well, yeah, thank you, Adina. I did not myself participate in last year's, so I don't have a frame of reference for comparison. But I can say that, participated in 2 of the preliminary sessions that were closed public, but I would say in those sessions it was really, I thought, very productive. We had a good cross-section in the sessions I was in that included patients, who are using the drug, clinicians, and as well as patient advocates. And it was a dialogue. It was more of a, and there was interaction. There was a lot of positive comments about the importance of these medications, and obviously concerns about the cost, and that's the purpose of the process. And we were able to discuss briefly some of our concerns to ask CMS to mitigate some of the unintended consequences of this process, such as you mentioned, the increased the tendency of plans to move to utilization management to cover their costs. We're not opposed to utilization management if there's a clinical reason for it, but we're very concerned about the growing trend of utilization management for the wrong reasons. So I think it was very engaging. In the town hall meetings that we participated in, it was a little different. You had 4 minutes to make your case, and you were done, but we were able to sit through the whole session, and it was open to the public, and we felt that was a plus, and we were able to hear what others had to say. So it was a good experience.
Yeah, and I know I heard you say that, last year, patients that came in, they just came and spoke and nobody responded to them. And this year it was more of a dialogue and a conversation, and that we were really appreciative of that.
Great, yep.
Yeah. All right, on that note, we are looking forward to hearing more about all of this and more from our panelists. Thank you so much to The Hill for hosting us, and thank you, Scott, for sharing all of your insights.
Thank you, Adina. Pleasure.
Thank you to the Alliance for Aging Research for sponsoring today's show. Now please welcome to the stage Allison Barkoff, Health Law and Policy Associate Professor at George Washington University and former Acting Assistant Secretary and Administrator of the Administration for Community Living at the Department of Health and Human Services.
Good morning, Allison. Thank you so much for joining us. It's great to be here with you. Let's just jump right in. Obviously, the recent reorganizations and mass layoffs at the Department of Health and Human Services included the administration you used to run. That's the Administration for Community Living, also known as ACL. Tell us about ACL's mission and what the impact of its, axing has had on aging Americans across the board.
So for people who aren't familiar with the Administration for Community Living, it's the agency within the U.S. Department of Health and Human Services focused on older adults and people with disabilities and bringing together all of the programs that help people live in their own homes and participate in their own communities. It has a wide range of programs. You may not have heard of ACL, but you certainly know our programs. Things like Meals on Wheels, things like Adult Protective Services, Long-Term Care Ombudsman, and programs that help people transition to their own homes when they have a hospital or nursing home stay. Incredibly critical with a huge reach to 10 million older adults, people with disabilities, and caregivers. And it has had strong bipartisan support as an agency and our programs across the board, which is why I think people were incredibly shocked when HHS announced its reorganization, and in that said that the Administration for Community Living would be eliminated and its quote-unquote critical programs spread across 3 separate agencies. ACL is really about a system of supports, and so the idea that these would be separated, I think, are incredibly problematic. We've seen over half of the staff completely eliminated, the entire budget teams and grant teams, policy teams, staff in the regions, which has had a direct impact on access to services. And then in the president's budget, the leaked OMB passback, shockingly, almost 20 programs are proposed to be eliminated. All of the programs that address abuse and neglect of people with disabilities and older adults, many of the programs that focus on chronic health conditions, despite that being a priority for the administration, and some really critical programs that support family caregivers like respite. We have actually seen impacts happening already. Because of the reductions in staff, they were not able to get out funding in a timely way that was passed by Congress. And these are very small agencies that provide services in every local community and state. And we started seeing agencies having to put people on waiting lists, turn people away, things like Meals on Wheels. Protection and advocacy agencies having to stop taking in clients, stop monitoring institutions for abuse and neglect. And I think the uncertainty about both where ACL programs are going, which programs will continue, has meant really out in the networks, a lot of resources going towards emergency contingency planning instead of providing the critical services that people rely on day in and day out, literally to stay in their own homes.
You know, you mentioned the funding cuts, the staffing cuts, obviously services like Meals on Wheels being cut. I'm curious, have you heard directly from Americans who have been impacted by these cuts, say someone who, you know, was a recipient of Meals on Wheels? I imagine it's not good, but what are they thinking about this? I mean, how are they moving forward right now?
Yeah, I really want to commend the aging and disability organizations. This is a place where advocacy has been incredibly effective. I think for many of you, people with CDC, with NIH, with really big things happening at HHS, many of us were concerned that ACL and the cuts and elimination of the agency would just fly under the radar. But aging advocates and disability advocates have been incredible in lifting up the importance of these programs. I have seen so many local stories on the news where people talk about literally what these programs mean in their lives. I had the privilege of being on CNN. And, again, people might not know ACL, but people know these programs in their community. They know senior centers, they know Meals on Wheels, they know the legal agency that they can go to and get help. The state health insurance program is another one. We have millions of people who are low income on Medicare and on Medicaid, and these are programs that, help people navigate. I think the irony of the proposed cuts is that cuts to ACL mean costs to other programs. These programs that ACL provide help keep people in the community instead of in more expensive nursing homes. For 1 day in a hospital or 10 days in a nursing home, you can feed someone on Meals on Wheels for an entire year. And that means reduced admissions to the emergency room, to hospital, to nursing homes, reducing chronic health conditions. Literally, ACL's programs save billions of dollars every single year. So it's incredibly confusing when we're kind of looking to focus on chronic health, when we have an exploding aging population, 11,000 people literally every day turning 60 and becoming eligible for Older Americans Act programs. This is the exact wrong time to be thinking about cutting ACL and cutting programs.
So you penned an op-ed calling on Secretary Robert F. Kennedy to reconsider these cuts. First of all, have you gotten any response from the administration? Second of all, what kind of ways are you seeing recipients of these programs, former staff members, pushing back or trying to raise alarm about the cuts?
Yes. So I wrote an op-ed together with the founders of the Administration for Community Living. Again, the idea that HHS put out is this is about efficiency. ACL was created 13 years ago for the very purpose of efficiency, taking programs that were serving similar populations with similar goals, bringing it into a single agency to make sure at the federal, state, and local levels there was coordination of programs. And really, over those 13 years, it allowed us to stretch resources further to really serve as the glue and the coordination with other major federal programs like Medicaid, Medicare, Social Security. And we really wanted to emphasize, maybe Secretary Kennedy and the administration didn't know the history and didn't know the real need. We have had no response to that op-ed, and I think what's even more concerning has been the absolute lack of transparency and engagement of stakeholders. We only know the number of people who are RIFed literally because people are reaching out to staff and collecting, it's this person, it's that person, it's that unit. There has been no information. We are now almost 2 months past the announcement. We have absolutely no idea what programs are going to what agencies, what programs will be continued. And I think most importantly, we have no idea how, with less than half the staff, programs can be implemented, funding can go out, and in fact, the agency that many of the programs will go to, the Administration for Children and Families itself, had a nearly 40% cut in their staff. How they'll be able to take on thousands of new grants and dozens of new programs is incredibly concerning. This is where I think advocacy has been incredibly important, from the networks, telling stories in the media, and the oversight from the Hill. We heard from Congresswoman Chu about the many letters, the hearings. In fact, later today I will be testifying. The Democratic members of Congress felt like it was important for the public to hear from former leaders of HHS agencies that are being eliminated about what is really happening and what that means for the American people. So this is a time where there is a lot of uncertainty and a lot of chaos, and we are seeing that translate literally into the field and into the programs that people rely on every day.
You mentioned that these cuts were announced just 2 months ago. You left your post in September, penned a very optimistic goodbye letter. I know you've said ACL has been your life's mission. In September, when you were leaving, could you have imagined that we would be where we are right now today with the program?
It's pretty astounding. I have been in and out of government several times, and I certainly understand different administrations have different priorities. As you heard from each of the speakers, older adults and aging issues have always been bipartisan. I left at a time where we had literally worked in a bipartisan, bicameral way with Congress on reauthorization of the Older Americans Act. I think we all felt confident looking at the demographics, looking at the cost effectiveness of these programs, that we were on a really good trajectory. At ACL, we worked really hard, and a priority for me was, let's really think about durability. We put out the first Older Americans Act regulations in 30 years, really trying to set up the networks for success for this growing aging population. I could not, in my worst nightmares, have ever thought about ACL being completely eliminated, cost-effective programs that have had long-time bipartisan support, SHIP programs, falls prevention, adult protective services, long-term care ombudsman being proposed to be completely eliminated. And then just, to foot stomp what you heard from many of the other speakers, to look at the entire safety net system. It is not just ACL and its programs that are at risk, but literally programs like Medicaid and SNAP. And even though they don't say it's about cutting Medicare, the cuts to Medicaid are cuts to Medicare. 1.3 million dual eligibles, according to the Congressional Budget Office, will lose Medicaid. And as we heard, the most at risk from these cuts, despite people saying we are protecting vulnerable populations, don't worry, we're carving out older adults and people with disabilities, states, when they have huge budget holes, will have absolutely no choice but to cut optional home and community-based services. And in fact, I just published an article going back and looking at what happened in the Great Recession, and 50 states in DC, out of 50 states in DC, cut home and community-based services, and their waiting list grew. So this is just, I think, an existential moment for older adults, and the incredible work that we collectively have done over the last several decades to create systems that allow people to age in place with dignity and independence.
It's incredibly ironic because, as I was saying with Congresswoman Chu, both parties rely, I don't mean to make this political, but senior citizens are very, very reliable voters. You take a walk around the House of Representatives or the Senate, there's a lot of senior citizens. This president, the last president, senior citizens. So it's just remarkable to see this. My final question, I want to end on a hopeful note, and I know that, it's not a great time in this field, but is there any ray of hope here? Is there anything that you can look forward to? Maybe is there a silver lining to all of this?
Yeah, I will give a couple silver linings. One, I think that this has really created an opportunity for us to create visibility and elevate the incredibly important programs that support older adults. I want to, again, just lift up the advocacy by the aging networks, by the disability networks, and I think that in the long run will really, really help us. The second thing that I am optimistic for, we have to make it through this fight that we are experiencing right now. But I think the fact that we are really talking about long-term services and supports in some ways has created this opportunity. It's not going to happen in Congress now, but the politically impossible will become the politically inevitable. And I think it is really giving us this opportunity to think about long-term services and supports, caregiving. How do we make sure we are not completely reliant on Medicaid, a poverty program, as the sole source to support people really in their own homes and communities? So I think there is some optimism. We have to make it through, and I am incredibly proud of just the way the community has activated, really lifting up the importance of older adults and people with disabilities and the programs across the federal government.
Elsa Barkoff, thank you so much.
Thank you so much for having me.
So before we move on to the next panel discussion, I want to mention that despite our best efforts, we weren't able to secure a Republican lawmaker to join us today. And understandably, we know that there's a lot going on with the budget reconciliation process. For example, the Budget Committee met at 1 a.m. last night. So busy time on Capitol Hill. So on that note, I want to direct your attention to the screen for some recent highlights from discussions from Republicans about the topic at hand. Let's take a listen.
It ought to be just a basic foundational principle. It is wrong to cut health care for the working poor. And that's what we're talking about here with Medicaid. My state is a Medicaid expansion state. Over 20% of Missourians, including hundreds of thousands of children, are on Medicaid. And Mono, they're not on Medicaid because they want to be. They're on Medicaid because they cannot afford health insurance in the private market. These are working people and their children who need health care. And it's just wrong to go and cut their health care when they're trying to make ends meet, trying to help their kids, trying to make sure that they're able to provide for their families. So I hope that the House GOP and the Senate GOP will get the message here. By the way, President Trump has said the same thing: no Medicaid benefit cuts.
We have got to change the direction of this town. And to my colleagues on the other side of the aisle, yes, that means touching Medicaid. It went from $400 billion in 2019 to $600 billion this year. It'll be over $1 trillion in the 2030s. We are making promises that we cannot keep. We do need to reform it. We need to stop giving 7 times as much money to the able-bodied over the vulnerable. Why are we sticking it to the vulnerable population, the disabled and the sick, to give money to single able-bodied male adults? We shouldn't do that. We should reform it. But guess what? That message needs to be delivered to my colleagues on this side of the aisle too. We are writing checks we cannot cash, and our children are going to pay the price. So I am a no on this bill unless serious reforms are made today, tomorrow, Sunday. We're having conversations as we speak, but something needs to change, or you're not going to get my support. I yield back.
We have a tremendously unified party. I don't think we've ever had a party like this. There are some people that want a couple of things that maybe I don't like or that they're not going to get. But I think we're going to have tremendous, not luck, we have tremendous talent. This man has done an incredible job as Speaker. We are looking at one thing. We're not doing any cutting of anything meaningful. The only thing we're cutting is waste, fraud, and abuse. With Medicaid, waste, fraud, and abuse. There's tremendous waste, fraud, and abuse. There's incompetent things, but we have illegal aliens that are multiple killers with multiple murder records getting Medicaid. I don't think anybody minds if we cut that. The Democrats, on the other hand, are going to destroy it because they're going to leave these people on. We're cutting three things: waste, fraud, and abuse. We're not changing Medicaid, and we're not changing Medicare, and we're not changing Social Security. And if I wanted to do those things, I would have done it during my 4 years that we were.
It is now time for our panel on aging, access, and affordability. Please welcome Julia back to the stage. She's joined by Edwin Walker, former Deputy Assistant Secretary for Aging at the Department of Health and Human Services, Sue Koob, CEO of the Preventive Cardiovascular Nurses Association, Peter Rubin, Executive Director of No Patient Left Behind, and Natalie Keene, Director of Federal Health Advocacy at Justice in Aging. Welcome all.
Thank you, everyone. Edwin, Sue, Peter, Natalie, thank you so much for joining us. We have a pretty big panel, so maybe I'm going to start with a broader question. And I know a lot has happened in the past 5 months or so. So I want to go around and hear how or if your work has changed since the new administration. Edwin, you seem to be very animated. Let's start with you.
Well, I would say yes, my work has changed because I thought I had retired, which I call being rewired, to do things on my list like travel and read books and go to museums and take advantage of Washington, D.C. And yet, what do I find I'm doing? Trying to console staff, trying to figure out what the chaos is all about, trying to figure out what is still here that we've always enjoyed and known and has provided care and support to millions of senior citizens across the country. And we're trying to put it back together. We're trying to save, we're trying to preserve, we're trying to protect. So that's what I've been doing.
Sue?
Thank you.
Yeah.
I would say that in general, our policy and advocacy priorities have not changed. But there's so much happening around policies shifting around our priorities that we really are just trying to stay on top of things and really try to stay as informed as possible so that we're ready to speak up when needed. So just a little bit more of a scramble in terms of trying to stay on top of all of this changing policies.
Scramble, yeah. For reporters, we're kind of in the same boat, so I can relate. Peter, how about you?
Similar response, where our guiding principles have not changed. I mean, we do seek to achieve affordability and innovation for patients, payers, and society. I think it's just how you get there is a little different, and I think the ability for us as our sort of expert network of investors, the small biopharmers they fund, and the patient advocates, providing that sort of expertise to provide real-time line of sight and insights to the folks we're disrupting is something that we've been able to do as well.
And Natalie?
So Justice in Aging, our mission is to fight senior poverty, and we're still doing that. The programs that we're talking about today, Medicaid, SNAP, Medicare, Older Americans Act programs, these are absolutely indispensable tools to fight senior poverty. They need to be strengthened. That's what we were working on a lot last year, and now we're in the mode of protecting these programs, making sure we're preserving them so that we can strengthen them.
So Natalie, I want to zero in on that because when we look at Medicaid and SNAP in particular, and as Allison brought up, Medicare also is being impacted. Those programs are facing very potential cuts, at least in this House bill. Now, as Congresswoman Chu said, once we go into the Senate, maybe some things change. So what does that process of preserving look like when you have a majority of Republicans and President Trump kind of pushing in this direction?
Yeah, I mean, this is the biggest threat to Medicaid that we've seen, the biggest amount of funding that has ever been proposed to be cut from Medicaid. So hundreds of billions of dollars. There is no reinvestment. This is not strengthening the program. This is really cutting it. And there's a number that I hope everyone can keep in mind, and it's 1 in 5. So there are 1 in 5 people with Medicare who also rely on Medicaid. They cannot get access to health care or meet their basic needs without both programs. 1 in 5 older adults ages 50 to 64 are also enrolled in Medicaid. So they need Medicaid for their primary health insurance before they become eligible for Medicare. Many of these folks have had to retire early. They have chronic conditions and disabilities. They absolutely have no other option besides Medicaid for their health insurance. And then 1 in 5 people enrolled in SNAP are also older adults. So this is, these programs are incredibly important for older adults. And we're just really worried about the combination of cuts and what would happen. So there are direct cuts being proposed in the legislation to both Medicare and Medicaid. One of those cuts is rolling back rules that really modernized how older adults and people with disabilities can enroll in Medicaid. There are programs that Medicaid helps people pay for Medicare costs. Medicare is actually quite expensive, especially for low-income seniors. There's a $185 a month Part B premium, as well as 20% cost sharing. Medicaid helps cover those costs. So when you take that away, and Allison mentioned the 1.3 to 1.4 million people with Medicare who could lose this assistance, when you take that away, the consequences are so horrific. It means people won't be able to see the doctor because they can't afford that copay. It means that $185 a month Part B premium starts getting deducted from their Social Security check every month. And that's the only income most of these folks have. So what do we see then? We see eviction notices because they can't pay their rent. The consequences are very serious, and these programs are already under-enrolled. And so when we see cuts to the SHIP programs that help people navigate, we know that fewer people who are eligible for this assistance are going to be able to get it.
So Sue, on the question of the patient, how is the cardiovascular health of older adults being impacted by disruptions in primary care access or even staffing shortages in some?
Yeah, I mean, we're seeing a huge impact on preventive services, right? So if we see a shortage in our workforce, there's less opportunities for preventive care, for regular checkups and visits and screenings for things like blood pressure and cholesterol. And so the long-term outcome, it was sort of mentioned by another panelist, it's so ironic that we're seeing these massive cuts in terms of saving money when it's really going to cost the system that much more money, because in the end, we're losing access to these preventive services, which are so important for cardiovascular care and other chronic diseases.
Right. Edwin, I'm curious because you obviously have, experience in this area. We're seeing, lost my place there. What advice do you have for younger policymakers, advocates who are taking up this work right now? I mean, we're sort of, and I don't mean to use a cliche, but we're sort of in unprecedented territory. We haven't seen cuts like this for quite some time.
My advice for young folks is to understand that it's not just a seniors issue. Mm-hmm. It's an everyone issue. In fact, what we're seeing and what we clearly know will be the case is that with this level of cuts, it's going to shift the burden of costs and the burden on families down to states and families and community-based organizations, including faith-based organizations. What that means for a younger generation is that they're going to be taking care of older individuals. It's going to completely disrupt, change their lives, and it's going to impact their ability to go to work because they're going to be the caregivers. They're going to need to be the caregivers. I want to also comment on the preventive component because, as Allison mentioned, all of the preventive services under the Administration for Community Living were also eliminated. That means that it's not a wise approach. It is going to result in higher costs. We administered an entire suite of healthy aging, evidence-based prevention initiatives that focused on, they were tested by NIH and other research organizations to prove that it would increase the ability of older people to continue to live in their own homes, to continue to be healthy, and not have a burden on Medicare, Medicaid. And we know that, like falls, something like as simple as falls, $80 billion in costs, 75% of which is borne by Medicare, Medicaid, is a result of older people falling, because the rate is 1 in 4 older people fall every year. If we don't have the funding to invest in falls management and teaching people how not to fall and to ensure that their homes are safe from falling, we're only going to increase the burden, the cost burden, and it's also the leading cause of injury, both non-fatal and fatal injuries in older adults.
Peter, I want to bring the conversation to prescription drugs, your realm, because we know that there's been, some bipartisan progress and there is bipartisanship on that issue, but we know that No Patient Left Behind has pushed for systematic drug pricing reform. How do pricing dynamics uniquely impact older Americans under Medicare?
So a few things. First of all, I think I would sort of combine our mission as how do you enact insurance reform so that if a doctor prescribes a treatment and the insurer authorizes it, it's affordable to the patient. And that's really a function of the lower out-of-pocket cap that the IRA put forward that only applies to Part D as in drugs and not the Part B as in biologics. So when you start seeing things like the pill penalty, which incentivizes new R&D in shots that are covered by Part B as in boy that are not covered by the out-of-pocket cap, that's something that's concerning when the reality is, as I think you heard earlier, that by incentivizing new small molecule R&D, you not only get sort of, it's just as risky to develop and discover as a large molecule, but it's less costly to manufacture, something you can take at home, it's interchangeable at the pharmacy, and so it goes generic almost immediately. So that's the type of innovation that you want to continue. And the other concerning part about the pill penalty is that it actually reduces the incentive for generics to try and enter the market. And so that means fewer generic drugs and fewer utility of existing new drugs. So that's the sort of dynamic that we're trying to show, that how you get these long-term savings by ensuring that balance of affordability and innovation.
Right. And just to drill in on that point,
please.
we know that the EPIC Act, which the administration has endorsed, addresses the pill penalty, but I guess what does the reform look like for older Americans in the long run?
Well, one, I think reform for older Americans is one, to sort of get back on track and sort of first of all, like as Edwin was saying, we call ourselves No Patient Left Behind because patients, it's all of us. We're all going to be one day patients, and we're all hopefully going to be seniors as well. So if you think about it, rather than just sort of like a year or electoral issue, but as a multi-year sort of does the nation look like in 10, 20, 30 years, that's the perspective I think that all of us bring to the debate. And so when it comes to seniors now and in the future, it's how do you ensure that pipeline of innovation continues? How do you extend the out-of-pocket costs to the near retirees in the ACA coverage, and also how do you ensure that there are insurance reforms to ensure that actually patients see saving at the pharmacy counter, such as the PBM reforms. And I think you can take that holistic approach where you're able to extract the same amount of revenues that you would under current law, but do it in a way that actually preserves affordability and innovation and extends benefits.
Right, and Sue, I want to get your perspective on PCNA's emphasis on patient education. How do we empower seniors to manage their health when a lot of these support programs are being cut?
Yeah, I think it's going to be a huge priority that if we see cuts to these programs, that we're able to inform seniors about what's coming in terms of their care. And so last year we partnered with MapRx, and when there were changes to Part D, we really wanted to make sure our nurses were informed about these changes, because Our specific nurses treat over 2 million patients per year. So there's a real opportunity to use the nursing community as a way to educate our seniors in terms of changes that are coming, and how maybe we can think more about using community services, or also encouraging our seniors to meet with legislative representatives, talk with reporters about some of the negative things that these changes and how they're negatively being impacted.
So I want to go down the row again. We've heard the concerns and sort of, throughout this morning, and kind of the warning signs, the unfortunately negative impacts we're seeing. What can everyday Americans do? And you touched on this, Sue, but what can they do if they're concerned about losing these programs and if they depend on these programs? I'll start with you, Edwin, yeah.
Well, I'm going to speak specifically about what we refer to as the National Aging Services Network, funded primarily through the Older Americans Act, which I would mention will, just in the month of July, along with Medicare and Medicaid, celebrate 60 years of success. Those three programs were part of President Johnson's three-part strategy to combat the war on poverty. At that time, most older people lived in poverty without access to physicians or hospitals or health care. That has completely changed in this country as a result of the success of these programs. It would be a shame to see these cuts across the board be implemented at a time when we're about to celebrate the success of these programs, and that have changed the trajectory of older people's lives in this country, enabling them to live in their own homes and communities and to maintain their health. We've been a leader in the world in this regard, and it's just a shame. So I believe that what older people can do and family members can do is make it known that this is going to truly impact their lives. It's going to change their lives dramatically. Everyone needs to be involved. It's not just, as I said before, it's not just the seniors. It's going to impact every aspect. We have 54 million caregivers, family caregivers, for whom, if we didn't provide support and services, it's estimated to exceed $600 billion a year. Well, what are we going to do? So people have to write, people have to be involved, they have to be engaged at every level. They have to talk to individuals about what the impact really will be on them.
Sue?
I agree. And I think as a representative, as a CEO for a national organization, we need to look at trying to bring together patient organizations, professional organizations, and other agencies to really raise these patient voices and tell the stories about what we're seeing in terms of how detrimental these cuts are or will be. And I think it's really on all of us to come together as a community to try to raise those voices.
And Peter, from your perspective?
So I think there's a few things, which is, one, silence is not a strategy. There's a whole cohort of people who think if I just sit in a corner and be quiet, nobody will find me, no one will pay attention to me. That's not the case. Secondly, I also think that just outrage about preserving this past status quo is not a sustainable strategy as well. Not just because, disruption is clearly in the mindset. And I'm old enough to remember when the extremism of the Contract with America transformed into the Balanced Budget Act of '97, which ended up not only preserving the safety net, but also eliminating the deficit and actually almost eliminating the debt. So from my perspective, it's what are the productive, proactive solutions that we can all bring together that that leverage the disruptive innovation into that sustainable future?
Natalie?
Yeah, telling stories is the most important thing. Medicaid is part of all of our lives, especially from the perspective of older adults. If you've had a loved one in a nursing facility or receiving help at home with activities of daily living, chances are Medicaid was paying for that. And Medicaid also probably provides health insurance for the caregiver, direct care worker, and often family caregivers as well, who are supporting older adults in the community. So, it's so important for all of us to find that connection with Medicaid and know if it's not part of our lives today, it will be one day, and we want to make sure that it's there for all of us.
Edwin, I'm sorry, Sue, were you going to say something? No. Oh, no worries. Edwin, we talked about what everyday Americans could do, but I wanted to get your perspective on what should advocates and state leaders now do to safeguard these, the aging services infrastructure, because you hear Republicans say, well, we're punting SNAP, punting Medicaid back to the states. That's their argument.
I've been around a long time, and I worked at a state level. States cannot absorb this. Family members cannot absorb these cuts. Community-based organizations, faith-based organizations cannot absorb these cuts. It's simply not true. And it's compounded by the fact it fails to recognize the sheer demographic imperative we have here. In less than 10 years, we will have more older people than we have children in this country. How in the world can anyone believe a good strategy is to reduce services at a time when we're about to have an increase in demand? So people need to speak up. They need to be very vocal. They need to understand that it impacts them at a very personal level. I'll say this, my history throughout my career, it was always that we're the best kept secret. Well, we shouldn't have been a secret. We should have been known at the local level. People never even understood that it was a federal program. They embraced the Older Americans Act because it went from the federal level down to the state, down to through area agencies to local community providers. And they felt a real sense of ownership. It was theirs. On the transportation van, it was their name. On the Meals on Wheels, it was their program. That's why it's been successful, because states put in their resources, local entities put in their resources, and older people themselves contributed their time and their resources, their money, because they felt it was theirs and because they knew that if they did that, it would expand the services to provide those services to people, other people in need. And that's been the beauty of this program. We don't need to cut it. The timing is all off.
So it's sort of an effort between local communities, the state, and the federal government.
It's always been a partnership, a huge partnership. In fact, GAO studied the Older Americans Act structure, this national aging services network that we talk about. And they said it's really the right model for federal programs. It has a small federal footprint that provides guidance and sets goals. It then goes down to the state and local communities. The strength has always been at the bottom, at the local level. That's what's also been studied by other countries. It's bottoms-up planning. It is responsive to the needs in local communities, and it has worked so incredibly well. And now we're facing, based on the leaked budget, elimination of many of the protections in the programs. Allison mentioned the long-term care ombudsman program, a program where you train and certify volunteers to go into nursing facilities and other long-term care facilities to speak on behalf of residents who don't have a voice, who can't protect their own interests. Why in the world would you get rid of that? It makes no sense. Not to continue funding for the Adult Protective Services program that addresses issues of elder abuse, neglect, and exploitation, where there's the data shows that at least 1 in 10 people are exploited every year. What's going to it just makes no sense at all.
Right. Natalie, Justice in Aging has sounded the alarm on racial disparities in aging. Where do you see those inequities deepening, and what can we do to address them?
Yeah, thanks for this question, because older adults experience a lot of harm based on historical discrimination that compounds over the lifetime and that continues. And in fact, if we look at the connection between Medicaid and housing, we see some of those disparities, and something in this reconciliation bill that will actually make that worse. So to qualify for Medicaid long-term care, people have to spend down their income and assets. The one thing that they're allowed to keep is their home that they're living in. And we know that home ownership is one of the few ways to build intergenerational wealth. We also know that there has been a lot of discrimination. So people of color have had a harder time building that wealth. Well, under the reconciliation bill that's being considered right now, they want to cap the value of the home that can be disregarded when someone is becoming eligible for Medicaid. And when we see rising housing costs, someone who's lived in their home for decades has almost no income, no other assets. They could be shut out of Medicaid or forced to give up their home. And that only worsens disparities for the next generation.
I know we have a few minutes left, but I want to ask a question, and hopefully on a lighter note, a question I ask Allison. Is there anything in this field that you are hopeful about? Is there any kind of silver lining right now? I know it's a dark time, but I just want to get your perspective, Edwin.
I am an eternal optimist, and I have dedicated my life to this field, a field I fell into. I didn't plan to come into the field of aging, but I often say I fell into the field and then I fell in love with it. What I believe, the hope I have, is that the people who have dedicated their lives to the issues that we are all talking about today will continue to dedicate their lives, will continue to raise their voices, will get others who are not aware to understand and to appreciate the issues that really matter to families and older people in this country.
Yeah, it's been mentioned by other panelists today, but I think what's really sort of incredible about this whole thing is how many people have really come together to talk about these issues and think about how we can combat and try to maintain funding for these services. And so I guess I would say the silver lining is really just to see the community really step forward on this.
Right, Peter.
I think from, my approach is that you sort of see the extremism on both sides of sort of the differentiation is the political value. And I'm hopeful that this debate, which, is informed by, I think, a lot of perspectives, leads to sort of the sort of sensible center, common sense path forward, in the sense of yes, it's silly to think that anybody would fake cancer to get free chemotherapy. So what's the point of increasing out-of-pocket costs when your doctor-prescribed treatment is authorized by the health plan, and you see health plans restructuring their benefit structure so that they actually raise, out-of-pocket costs for people in that situation. So I think, the ability for people to say, hey, we're gonna have this big fight, but then as the process moves forward, we can move towards the center. Let's find the good ideas on both sides and actually achieve that sort of affordability and innovation that I think we're all hoping for.
Natalie.
Yeah, what gives me hope is that Medicaid is incredibly popular, as is Medicare, and polling shows again and again that the people are with us on wanting to protect this program, all of these programs from cuts. And so, as others have said, bringing the community together behind this, I think we are here to protect it, and we'll do everything we can to rebuild and strengthen it in the future.
Well, on a hopeful note, thank you so much to all of our panelists. We appreciate your time. What a great discussion. Thank you all for joining us.
That brings us to the end of our program. Thanks to all of our great speakers this morning. On behalf of the Hill and our sponsor, Alliance for Aging Research, we'd like to thank everyone who joined us here in person and who joined us online. If you missed any portion of today's discussion, the full event video is available on thehill.com. Thank you very much and have a great day.